Hello, everyone. Good morning and good evening. Thank you so much for joining us for our leaders session today in Sync. Today, we are going to discuss transforming client outcomes through healthcare and technology expertise. We have amazing leaders here with us who do not need any introduction. Please join me in welcoming Vijay Venkatesan, Chief Technology Officer, and Jashanjeet Singh, Vice President Operations, Clinical Support Solutions. Unfortunately, Ahmed Mukaddam isn't available with us today due to some unavoidable circumstances. And with that, we'll shortly begin the session. I'm Sravanti Ivaturi, and I'll be moderating this session for you today. Our core philosophy is that future of excellence in healthcare resides at the crossroads of profound healthcare domain expertise and advanced technology. As the landscape shifts, this synergy is instrumental in reimagining client outcomes, ensuring they are more intuitive, seamless, and centered on the patient. With that, let me start with the first question for Vijay. Vijay, from your perspective, how is the integration of healthcare expertise and technology reshaping our ability to deliver value to our clients?
Hey, good morning, good evening, everybody. And thank you, Sravanti, for that question to start off and kick off our conversation. I think from my vantage point, from a technology lens, if I look at it, right, the integration of deep healthcare expertise with advanced technology is fundamentally transforming how we deliver value within IKS Health on behalf of our customers. So our approach is we're not just layering technology on top of processes. We're really trying to create what we call an interconnected or a true agentic care enablement platform that unites the clinical, operational, and financial workflows. So healthcare expertise provides the critical context, because if you look at our 2,000 plus clinical staff and domain specialists that we have that ensure that when we use technologies like AI, that it understands first the nuances like clinical documentation, coding accuracy, denial prediction, or value-based care metrics. It needs to understand that, and that only comes through our critical context of the clinicians provide. Technology also, when we look at the new layers of AI that's coming, whether we call it generative AI or agentic intelligent platforms, what it does is it allows us to automate the chores of healthcare, whether that's administrative burdens that our physicians face or repetitive tasks that can be automated, or fragmented data flows with precision and with scalability. So when I look at the fusion of this healthcare expertise with the advancements in technology, I think the value proposition, as I look at it from a clinical perspective, or for our clinicians, it restores joy for them in medicine because it reduces burnout, giving them more time to do patient care. For enterprises, it achieves or drives measurable outcomes because that ensures that we are now giving them higher reimbursements, fewer denials, better quality scores, and financial sustainability. And then for our patients, it ultimately leads to what we call more coordinated and higher quality care. And the term we use is we eliminate the bad friction in healthcare, and we ensure that improves the patient satisfaction and patient care. So for IKS, this isn't just a concept or an academic exercise. Our platform really combines this human precision with AI scalability and ensures that we are able to drive better care more efficiently for our customers. And to us, it's not just a result is not just about cost savings, but it's really about more resilient healthcare organizations, that are financially viable and are able to deliver the care that they want on behalf of their patients.
Wonderful. Thank you so much, Vijay. Before we proceed, some quick logistical updates for all our audience here. You are in a listen-only mode to avoid any background noise. In case you have any questions, please feel free to put them up in the Q&A tab that you see on your screens. We do have a Q&A segment at the end of the session where we will be taking up your questions. So moving on to your question, the next question here, Jashanjeet. Can you talk about the capabilities or skill sets that will be critical for teams operating at this intersection of technology and operations, which will be applicable in the next 3 to 5 years?
Thank you, Sravanti. I think a very relevant question, especially in the context of where we are operating today. In fact, I get asked this question every single day, not only from the people who work on the floor, but from my directs as well, that where are we headed to? What is our future? Do the skill sets we have today, are they going to be relevant 5 years down the line? And the answer to that is simply yes. The skill sets are going to stay relevant, but the nature of work which we are going to do is going to get changed. I'm a firm believer of Pareto's law. Everybody understands Pareto's law. What I feel is, in the domain we operate, 80% of the tasks we do will be done by technology within the next 3 to 5 years. Humans will become the validators of that technology. So essentially, any leader who operates today or any person who operates on the floor needs to have a technology oriented mindset. You would have heard this as a buzzword within our IKS as well: human in the loop, human in the loop. So in next 3 to 5 years, a human is definitely going to be in the loop by design, by necessity of medical science, and by the sensitivity of the work we operate in. A human will be quintessential for the success of what we do, but in the loop as a validator and as a person who does the final touches to what technology brings the outcomes from. Obviously, a tech mindset is very essential over here. He needs to be very, very adaptable, which is very, very closely related to our value of agility. So agility, adaptability, you call it anything, a person who needs to succeed in this intersection of technology, where it is heading, has to be very, very adaptable. The goalposts are changing every single day. You cannot say this was my goalpost yesterday, how it has shifted. It is true for Vijay, it is true for me, and it is true for everyone. For example, we do productivity measurements of our folks on the floor. If technology comes and disrupt today, I'm not going to grow by 5%, 10%. It's going to be a tangential growth. So adaptability to that is going to be a very, very key quality which people need to have. And then I think what important quality which everyone needs to kind of inculcate, which is not like a born quality, you can acquire that as well, is attention to detail. So since technology will take care of the bulk of it, so the work which technology will not take care will be highly complex work, which will require intricate minds and intricate details to get into that weeds and solve for those things, whatever work is left behind. So attention to detail, a tech-oriented mindset, ability to be agile or adapt, and a person in today's world who can understand both the languages, the language of operations and the language of technology, and can actually bridge them, is also going to succeed at this intersection. Because as of today, there'll be hundreds of people in Vijay's team who would struggle to understand what is the clinical relevance of what they're trying to do. And hundreds of people in my team will struggle to interpret that into a language which can be codified and can be made into a platform kind of a model. So people who acquire those skills, who can bridge the gap between technology and operations in terms of understanding both the languages, is also the kind of people who will succeed. So these are the four things which come into my mind in terms of the skill sets I feel are very essential for the people going forward. And as you would have seen, none of them is out of this world. The population as it exists today can easily acquire those skills and make the first marches in it.
Thank you so much, Jashanjeet. I think there's a great takeaway for our audience here on all the four things that you've mentioned. And just building up on that same question, I would like to understand from a clinical standpoint, how has technology enhanced or complicated the entire delivery of patient-centric care and overall clinician experience?
You want me to take that?
Yeah.
Okay. So I'll step back, say a couple of decades, wherein healthcare primarily was more of a therapeutic domain. But with the advancements with diagnostic tools through technology, now healthcare has become more of preventive healthcare than therapeutic healthcare. Obviously, therapeutic healthcare will remain, the health systems will remain, but a large chunk of patients now can preempt, because of the advances of technology, can avoid hospitalizations through the advances of technology and move. And there's a paradigm shift of people who have moved into preventive healthcare from then being rather hospitalized at later parts of their ages. Now, what has happened in this is, I think you asked whether it is done or not done. Definitely, there has been a positive shift, right shift in this with the advent of technology. I think Sachin always says our goal is to make healthcare faster, cheaper, safer. I think it certainly has. Technology now with such advanced tools available has become more accessible to each one of us. The doctors have become more accessible to each one of us. Telemedicine is a perfect example of it. COVID saw the perfect manifestation of telemedicine, wherein each one of us could just use our mobile phone and get a consultation of a specialist, right? Now, even the health systems are advancing towards something like telemedicine, telerobotics, tele-ICUs, teleradiology. So the word tele has actually gotten into the ecosystem. And I have seen cases, I don't know if you heard a case study a few days ago, a surgeon sitting in France operated on a patient lying down on a bed in China through telerobotics. So that is to the extent it has went in. Obviously, advances are both from a preventive aspect as well and therapeutic aspect as well. But yes, healthcare has become faster, cheaper, and safer. And that is where companies like IKS is also kind of participating and contributing to raise the bar even further in terms of the safety, in terms of the accuracy, and in terms of the cost of delivery of healthcare. I think it's a very positive move, and there is only one way ahead of it. I think things are only going to get better from here.
Thank you so much, Jashanjeet. Vijay, we would like to hear from you. And the next question is for you here. What are the biggest challenges you think in translating the clinical and operational requirements into scalable tech solutions?
Yeah, and I try to answer this from a variety of perspectives. But before that, I also want to kind of address the previous question, right? When you look at the world of technology today, we are inundated with a world of point solutions. And every clinician that you talk to, or every health system you talk to, they are, just kind of bombarded with the amount of point solutions that they are not able to then say, how do I realize the value of these point solutions on behalf of my patients that reduces the administrative tasks that I have to do to be able to drive that care better and spend more time with my patients. So one thing that I think IKS has done this very effectively and really focused on the right problem statement is we have come at it as what we call a system of action. Rather than looking at it as a point solution, we have tried to reduce the amount of overwhelming force that is out there in a point solution model and really bring it in a more integrated, orchestrated way. So this notion of a system of action, the care enablement platform that we speak of, has been kind of an operating system to drive this transformation for our physicians. So I think that is going to be an important shift, and you'll see this shift happening as more and more EHR vendors are becoming system of action players as well. So that friction between what we do and what they're trying to do and how we do it better, because we have this combination of technology and human in the loop. So as we look to the future, I think your question was from the challenges perspective, right? Both from a clinical point of view and from a technology point of view. I think the goal that we all have to have is we have to remember why we are doing what we are doing in the first place. Our job is to have physicians spend more time with their patients. And how do we free up their time in terms of administrative burdens? And how do we do that in a way that is effective, scalable, and cost, and also a higher quality? So what we have to continually focus on is not apply technology as a wrapper to a process. We'll have to fundamentally look at how do we transform the process itself. And a lot of the efforts that we've spent, and I think Jashanjeet will agree, and if Ahmed was here, he would agree as well, a lot of the efforts that we are putting in from a technology point of view is to reimagine the processes. is to transform the process so that we don't take the same paradigm that a clinician or a health system has in how they've done things today and then replicate it within the IKS four walls. We are trying to reimagine and retransform. That to me is the fundamental change. And when that change occurs, there is a change management paradigm both internal to IKS and a change management paradigm on behalf of the customers we are operating on behalf of. So that change management cannot be minimized. There is going to be change, and we'll have to navigate that change, and there is a healthy friction in that. The other thing is that we cannot lose track of the fact that we are not using technology for technology's sake. We should think about these technologies as capabilities and figure out where best can these capabilities apply to deliver the outcome. So we cannot ever forget about what outcomes are we trying to deliver and why are we trying to deliver those outcomes and who are we delivering it for and what is the value we enable when we deliver those outcomes. So if you look at IKS today, we are very focused on outcomes as our service, as our USP. And that needs to be still the primary focus, and technology, the human in the loop, the clinicians we have, the technologists we have are all enabling those outcomes in as efficient a manner as possible. So it's a long-winded answer to say that think about outcomes, think about the why, and then work back to the how. And that's how we will try to minimize the what I call the challenges or barriers towards progress.
Right. I'll add a couple of things to what Vijay said, because we see this every day when we go for new implementations and transitions. I think the biggest barrier, what I see, is people have done certain things a certain way, like Dr. Vijay said. So I think moving them towards a piece of standardization and actually bringing in best practices of the industry and saying, hey, here are the gold standards of what it should be done rather than what you've been doing this way. I think once we move towards that realm wherein the acceptance that a company like us is coming with the best practices and the gold standards are going to be the norm, I think a lot of friction will be eliminated. It'll be a plug and play model, and people don't accept change easily. So I think bringing about that mental change, like Vijay said, change management committees, both internal and external, I think those are going to be very, very critical. I think everyone understands today, if they don't adopt technology, they are going to get outdated. People who are using it are going to take precedence over the others. So people do acknowledge that, but I think the mindset of change, I think that is where we need to be the kind of torch bearers of it, and kind of wherever such platforms we get a chance, we should always advocate that change is constant and standardization is the way forward. That is going to make healthcare more predictable and more safer.
Thank you so much, Vijay and JJ. My next question is going to be for both of you, and you guys can chime in whenever and however the sequence you would want. How would you think we can measure the success of customer experience initiatives that are driven by tech-enabled solutions?
I think I think I may have touched on this earlier. I think customer success is when the outcomes we have both agreed to deliver as being realized on a consistent basis, the net economic value that we are adding to them as a system is being realized because we are enabling that through the way we have approached using our technology for, frameworks or tools or products. But it starts with a simple notion in my mind, right? I mean, to me, success is because you are trying to figure out how is the best possible avenue I take to drive those outcomes. And the outcomes could be financial, outcomes could be clinical, or could be a combination of clinical, financial, operational. When you look at it that way, I don't, and again, I want to kind of maybe repeat myself a little bit and say that I don't think of this as a technology conversation at all. I look at it as what business problem am I solving? What is the business that the customer is in? What pain points are they facing? What does IKS have to offer that meaningfully changes the paradigm for them, that drives both their financial viability and their ability to drive better care to their patients? Because if you don't put patient at the center of this conversation, this just becomes us patting ourselves on the back of how great a technology company we are, or what a great products we have, how great our humans are in the loop that enable all this on a daily basis. I always start with who are we doing it for? And why are we doing it for? What's the mission in that? And if you start with that and then you work backwards, you start to eliminate what I call our internal frictions. Our internal friction could be, it has to be done this way, we have always done it this way, it should follow this protocol or that process. So I try to kind of distill all that and come out of it and say, what is the problem, how best to drive the outcomes, what is the right tools that we have that is applicable to that problem, and then what can we do to do it better, cheaper, faster, and then how do we get to those outcomes? Because once you realize the outcomes, we both benefit. IKS is a viable entity to drive this for other customers, and then the health systems themselves are able to do things better for their patients. So when those two are not connected, it becomes a disjointed conversation. When those two are connected, it becomes a value enabling conversation. So we use the term, how do we drive net economic value add? That conversation is all about outcomes. And it's not just financial, it's financial, clinical, operational combined. And that's how I think about this at all stages. And it's sometimes harder even for me as a technologist to think that way, because my teams will say, I am building a product to a specification that was provided to me by team A. I'm doing it because that's what operations wanted me to do it this way. But I try at least to the best of my ability to come out of that, because that is your daily process. But you still need to pull yourself out and say, who am I doing it for? What value am I trying to engender? And then how do I do it consistently and repeat it in a repeatable fashion?
I totally agree with you, Vijay, on this. In fact, I would like to supplement this with an example of a product that I operate. I think all of you would have heard about Assurex, which is the prescription renewal program or the product we have. So that single, simple product solves multiple problems in one go, which are clear-cut outcomes for the patient, for the provider, and for the health system where we have deployed that. I'll give an example. A patient has asked for a prescription renewal. A qualified pharmacist sitting here in India uses all the technology available through Assurex, goes through all the guidelines, protocols, all the safety checks, and ensures a safe refill in terms of dosage, quantity, in terms of the route is ensured and passed on to the provider for a signature. Now, this is ensuring highest level of patient safety and also avoiding malpractice for the provider at the same time, which he could have otherwise overlooked in his daily practice because of the busyness of the schedule and otherwise human tendency as well. Because we so much rely in healthcare on muscle memories, we tend to overlook the protocols and the safeties around it. And not only this brings in safety to the patient, avoids malpractice for the provider. Now, this brings in additional revenue for the health system if they want to look at it that way. Now, a patient was self-medicating for years without actually having done a lab test which was required to have that medicine, and also an office visit which was necessary for him to continue that medicine. So IKS, as a best practice, also advises the patient to get a relative lab test done. For example, if he's taking metformin tablet, which is used for diabetes for 6 months, please get a HbA1c done to get the next refill for your diabetes medicine, because it's already been 6 months. And also show to your provider in the next 6 months, because it is necessary. A physical checkup will determine how much dosage and what kind of drug you need to continue or not. So a simple product like Assurex, which is rule-based, guideline-based, can solve all the three problems at the same time, and all of our products do that. So I wanted to kind of echo what Vijay said. It is necessarily not technology, it is the outcomes which actually bring in all the desired results we look for.
Thank you so much, JJ and Vijay. I would bring up another question for you here. Can you help us with, say, a phrase or anything that comes to your mind that defines the future of customer value delivery in healthcare? And why do you think that's so?
Um, I've been thinking about that question a little bit in my own mind, and I'm saying, what is the right one-word phrase or one word, if you will? So symbiosis is the word that comes to mind for me, because at the end of the day, when I think about healthcare as a profession or even as a construct, it is all about symbiosis in my mind, right? So if I look at it purely from a technology perspective, where the world is moving to, I call it the human AI symbiosis. If I look at it from a provider point of view, it's the provider patient symbiosis. If I look at it from a provider health system point of view, it's the health system provider symbiosis. So I'll just speak to it from a more about what my orientation is, which is the technology aspects of things, right? What I think about the human AI symbiosis is that I don't look at it as, I know there's been a lot of articles, written recently about, well, technology replace people or people resisting technology. I don't look at it that way at all. When I think about symbiosis, I think about it as, how do I create a deep, intelligent partnership where we leverage our clinical expertise and make our systems leveraging AI as one unified force? Because what we bring at IKS is very unique in that way, right? We are not just applying technology without the clinical expertise. We are trying to figure out, how do I maximize both these components together as one unified force. The second thing we have to be cognizant of and be open to is that these systems, or call it AI agents or AI systems, agentic workflows, all these things, they do a great job of doing what I call the heavy lifting, which is documentation analysis, coding, denials, and figuring out how to prevent them, orchestrating, getting data, synthesizing data. So it does all of what I call the back office function so well, so that our clinicians and our operational teams then augment that with their judgment, with their decision making, and their empathy, which in which results, which Jashanjeet already mentioned, right? Dramatically higher productivity without sacrificing quality or compliance. Because that combination of humans with technology is where I think that symbiosis will fully come to bear. When you think about it from a client's point of view, right? Whether it's the health systems, the payers, the providers, this symbiosis of human AI, as I call it, or human tech, will translate into measurable value, whether it's reducing administrative burden or better quality or more time for patient care. For us, I think we've already down this pathway in a significant way with our agentic care enablement platform, where I truly believe that the future winners in this space will not be organizations that have the best advanced AI or the most clinicians. It will be the ones who can really master what I call the seamless collaboration between both. When I think about symbiosis, is that you should not know where the technology ends and where the humans kick in. It should feel like a seamless operations that will redefine the value in healthcare, right? Because when I think about our way of working at IKS, we say, how much can the machines do and how much should the machines do? And where do we need that clinical expertise or the human expertise, so that the value we generate at the end of it is a true partnership between machine and humans, but also true value to our customers. So that is the word I think about most of late, is how do I create a symbiotic, and again, I don't want your sci-tech fans and your science fiction fans to say Vijay is imagining a new type of a being. I'm not. I'm just trying to figure out what is that orchestration between humans and machines that will create the best value and best outcomes, is how I think about that one word.
Thank you so much, Vijay. I think that's a very interesting perspective to really think about for everyone around here. Jashanjeet, thoughts from your side, please.
So I think we are influenced by the ecosystem we operate. So we tend to be influenced and kind of come up with cliches or said one liner or a phrase around it. So the way we operate is very complex, very fragmented, operating in silos, not talking to each other. I mean to say that technology is not talking to each other, running for data integrations. So the way I would put it is, what comes to my mind is what IKS is going to do, or rather what we are going to do as a team is simplify healthcare. I think you just decongest everything which is choked up in various swim lanes, bring them into one common ecosystem, which is the IKS platform, and providers should just not worry at all. A simplified solution which does not allow multiple touch points, multiple apps, widgets, logins, passwords, different UI interfaces, just to get the simple outcome which he's looking for is better, cheaper, faster patient care. I think IKS as a team under Vijay's leadership and all other product and operation leaders we are committed to deliver that, and we are committed to simplify healthcare.
Perfect. I think that's such an amazing discussion we've had. Wrapping that up, I would now open the forum for questions from our audience here. Please feel free to drop in your questions in the Q&A section that we have, that you can see. The 9 dots on your screen, and you can key in your questions there. So JJ and Vijay, while we wait for our audience to key in more questions, we have one question here with us. How do we ensure that technology-driven outcomes are equitable and don't leave behind patient populations with lower digital literacy?
So I think, again, if you just think about technology as the panacea for all ills, and I think what Jashanjeet said is an important point, right? We are trying to simplify healthcare, and simplify doesn't mean it all is through tech. Tech is an enablement framework for that, but not the be all end all. At the end of the day, it's an ecosystem that you're creating that marries tech with the right kind of operational constructs, with operational flows. So to me, when you think about technology, it's the same way. I'll give a perfect example. Before the world of iPhones and all your new modern cell phones, right? Cell phone had a specific purpose, which was to make a call. Then it became your music device and your email device. Now it's an extension of you. So in some ways, what we have to think about is, regardless of what technology you're bringing in, what is the consumption mechanism by which people interact? Some people like text messages, some people like emails, some people like phone calls. So to ensure there's equity in healthcare, you have to understand the market segments you are in, the patient populations you serve, and what is the best means of engagement with them. And they will find different pathways. And as a conscious organization, what you're trying to figure out is what is the right mode of patient engagement that is necessary, or customer engagement. And so I don't look, again, I look at technology as one part of the ecosystem that we are trying to use to get to those means, but it's not the be all end all or the panacea for everything. And even today, I think even generally, if I took a poll of this audience, each person will have a different mode of engagement. Not everybody prefers text. Some people love it, some people don't. So that's the kind of more thinking you have to bring into this. And so I think as long as you keep that in focus, again, think about your patient or your customer at the center and work around as to the means of engagement. It's the way I think about it. So Jashanjeet would love to get your perspective.
I like to substitute this as an example because, like you rightly said, market will eventually find its own fit. But a perfect example from an Indian scenario, 10 years back, government wanted to open bank accounts for everyone. So somebody raised the question, a renowned parliamentarian said, oh, you expect the tomatoes vendor to have a swipe card machine on his cart and take payment through swipe cards 10 years ago? And go to the market now. Even the shoe cobbler takes payments digitally in India. So in fact, digitization or technology will become an enabler for those who are actually adverse or who are not who do not have got access to healthcare. So in fact, I see the other way around. Technology is going to become simpler for them. So all they probably would not need to do is just push a button somewhere on their mobile phone, somewhere in their house, push a button. That's going to book an appointment for them. Or their son sitting somewhere 1,000 miles away is going to book an appointment for them. So I see it from a positive context. I don't think anyone will be left behind. In fact, it'll be more inclusive. The population who is left behind today would also become part of the larger ecosystem. That's how I feel it.
That's great. Thank you so much.
It's an interesting paradigm also, right? In the US marketplace, you have rural communities that don't have Wi-Fi. So in some ways, you'll have to think through this from a larger lens also, which is just because you can digitize doesn't mean people can access. So when I look at rural healthcare in the US, it's a different marketplace. So we have to look at it that way also, because there are a lot of infrastructure components that have to be accounted for. But your point's well taken, JJ, that in India, it's a phenomenal shift in terms of digitization. And then I think by market segment, it may vary is all I'm trying to say.
It'll vary by market segment for sure. That's why I said market will find its own fit for sure.
Thank you. Thank you so much. We have our next question here, and I'll leave it open for both of you to jump in, whoever would want to answer. Interoperability, of course, remains a massive hurdle in healthcare. However, how can technology expertise solve the fragmented data problem to actually improve individual client results?
That's Vijay's question, so I'll leave it for Vijay to answer. That's the question I ask him every single day.
So I think we conflate. I think the way I think about this problem is in two parts. So I try to simplify it for the world, right? There's a problem, what we call as acquiring the data. And so when you think about interoperability, it is all about how do I acquire the data first, and then how do I write back something back into the EHR or the electronic health record or the practice management systems and so on. So that is interoperability. It's how do I bring things in? How do I push things out back into those systems? The data itself, in terms of data that I need to run my operations, both financially, clinically, and operationally, is a separate problem. Because acquiring the data is one, and that's where interoperability comes in. And where technology helps there are now there are standards of getting data, but that standards may not be adequate for all the data we need. So what happens typically is that when you look at a patient record or a chart note, those records may be available through an interoperable means, which are called FHIR standards or HL7. You can get those type of data. But let's say you want to run a predictive score for how sick a patient is, and what is their readmission rate going to be within 7 days or 14 days of discharge. Those require a different kind of corpus of data. And that is a different discussion, because for each client, we have to partner with them and say, what is a corpus of data you can make available to us? So the way we are approaching it is that we're saying, what is it I need to run what I call the workflow of revenue cycle management or a clinical documentation or coding on one side, while in parallel working to get that corpus of data that we need to be able to do those things at scale. And that is going to be a client by client discussion in some ways, though we have certain specific data specifications we ask for. It is still a client by client conversation. Now, what the TrueBridge acquisition does for us in a unique way is that there we will have both the system of data, or a record if you want to call it, and the system of action, which is IKS bringing our expertise to it. Therein where that paradigm will shift significantly for us, where we will have access to the corpus of data and to do the things at scale. So there we will have what I call both sides of the platform, both sides of this conversation under one roof. So you will see things shift dramatically differently on that side. And while in the current technology landscape, you are working at one client at a time. But so I separate acquisition from data harmonization. And in order to enable with the data we already have, what we are doing in technology today is we are building what we are calling a modern data platform, which will become the IKS gold standard for all data, which can be disseminated to any product or services that require it. So there will be more updates on what this modern data platform is, how we are building it, how that will simplify a bi-directional data exchange. So there are activities underway to enable that. So that's a very simplified but a complicated answer to the question. But there's a lot of nuances to this discussion.
Thank you so much, Vijay. We have another question coming up here. How will upskilling redefine roles in the US healthcare RCM segment? And how can we position ourselves through AI expertise to drive better financial outcomes for clients and elevate our careers?
I can talk from
You
the
want to take?
CSS standpoint. RCM
Please.
specifically, if somebody is asking, I think we need somebody from the RCM to answer it, or Vijay, if you can answer. But clinical support solutions, I can definitely answer.
Please go ahead, JJ, and I'll try to maybe put a wrapper on.
So I think the common platform will be the same. There will be growth in the kind of roles we do. It will not be monotonous, repetitive jobs. Those will be taken care of by technology. This job will require higher level of critical thinking, higher level of customizations, because you're only now working on the exceptions and not the mainstream work, which is taken care of by technology. You will have to play a larger role in customer management, because end of the day, technology cannot build relationships and maintain relationships. So customer management is going to become a key role, and how transparently you start communicating with your customers, because SLAs will become things of the past. You don't need to worry about now, oh, there is a holiday today, I'm missing my SLA, I need to call people on the weekends to work, etc., etc. All those things are going to be taken care of by technology. It'll be more customer centric, more high quality work, and more jobs which require critical thinking. Everybody, obviously, if you have these skills and you kind of acquire them on the go, obviously that will mean higher roles for you, and more roles in customer advocacy.
Yeah, I think this question also ties to an earlier question about how do we see the skill sets change in 3 to 5 years, right? It's the way I think about it is that think about the future in this simple construct, and this may be not a great analogy, I'll do my best, but the blending of operational and technical expertise will become the norm, meaning that you will think that a clinician who can code because they can pull up a chat GPT or a Claude code and they can type a prompt and get to the answer they want. They will be more sophisticated. So this blending of the skills of using technology is going to become more and more paramount, and also more and more simpler as we go through the next scale, if you will, the next wave. So clinicians who code and technologies to understand operations will become a norm. And that's my simplified view of the world. Like I will become an expert in revenue cycle operations, much to the surprise of my peers maybe. But I may be able to intelligently talk about how to prevent denials before it occurs, or how do I code a claim differently, or before it translates to a claim, what do I do on the source systems themselves to prevent a claim from being generated? These are the things where the blending of this, call it the fusion of operations and technology, will happen. And that is what we have to be prepared for. What I use the term as hybrid expertise. Nobody is going to be an expert in one vertical. You will all be hybrid experts. And then there will be some people who are hybrid experts with very detailed knowledge. Then you'll have hybrid experts who are across knowledge. And that will become the workforce of the future of sorts. And that we have to prepare ourselves for and do it in a very diligent way. And so that we as an organization are taking advantage of what's available to us and becoming more efficient at what we do. And because of that, our customers benefit and we are able to drive those outcomes. So that is an important lesson, and it's a change management aspect as well. So I don't want to minimize it, but it's a deliberate and a constant effort to get to that outcome. And that will be important for us, even within IKS and across the industry as well.
Absolutely. And Vijay, rest assured, our company is thinking about this. Our L&D teams are already bringing up modules, inculcating modules, which will be passed on to people for their benefit so that they can start acquiring those skills, which will be necessary. See, even if IKS has to operate at the level we do, we need our people to step up and learn those tools and learn those hybrid models, which will allow us to operate the way we want to. So IKS will take the front foot and kind of coaching and bringing up those modules, but it is also up to the individual. How do you grasp it and how do you kind of run away with it?
Absolutely. Thank you so much. I know such amazing insights that are being shared here. Just a quick heads up to our audience here. Don't worry about in case you're missing out on taking notes on this. The video for this session will surely be shared with you. We are recording this session and this will be shared after the event. Okay. Let's move on to a couple more questions that we have here. We have a question from Praveen. Does the expansion of AI-human collaboration impact enterprise compliance? And what are the critical risks to PHI data integrity and privacy?
I wish we had Amit Pandey on this call also as a panelist to give the more, clarified answers on this. But in general, when you use AI, and I think the reason both JJ and I have stressed human in the loop, and I think it's one of the things that we keep stressing in every discussion is because AI in general is a capability that can hallucinate at times. So when we use AI, the goal is to make sure we are using it in a responsible and ethical way. And that is the fundamental underpinning of how we are developing these systems at IKS. We don't ever assume that we defer to AI. Our job has always been to say, what can it do better? And is it doing it right? Do we have the auditors who are looking at it to ensure the accuracy and veracity of the information it's providing? And always starting with PHI and PII and HIPAA as the tenets on which we build our AI. So we don't think about them after the fact. It is the core from which we start, and then we add every layer of control to make sure it's responsible and ethical. So that philosophy of how we have developed our systems is the underpinning of our success to minimize these concerns, which are all legitimate concerns. Every organization is facing through it, and every organization will have, a little bit of what I call the risk reward of AI. And we are always cognizant that whatever we do, we can do no harm. And the operating system we are building is going to ensure that all times. And so that's why the human in the loop for us is an essential element. It's not a nice to have. It is an auditor in check, which will check everything consistently, reliably, and ensure the veracity of the information. So that I think is very critical for us. And that's why you will never hear us talk about 100% AI. We don't use those terms here. We say we take leverage of where AI can do things well, that are repeatable, that are verifiable, and will not compromise the regulatory and compliance aspects as well. So go ahead, TJ.
No, I completely concur with you. So human in the loop is by design and not by choice and not by compulsion. For every action we do, there is a responsible human being behind it and a fully accountable IKS ecosystem behind it. So obviously, at no stretch of imagination, even while developing the technology or using it on the go, I think we make sure that we are fully compliant to all the regulations around it, whether it is stateside, whether it is internal, whether it is to the industry. We make sure that there are no shortcuts when it comes to use of AI.
Thank you so much. I know with 10 more minutes to go, there are a couple more questions that have come in. We'll pick up one of them. With the success and support of our clinicians, patients, and clients as our common ground, what's the one thing you'd ask each of us to trust as we navigate this change going ahead?
I would like to take that. I think trust the change. People are not trusting the change. They feel They are not getting concrete answers, neither from us or from the leadership. Even they go about searching with their colleagues. I think trust the process, trust the change. We all are part of the change. Obviously, there is vulnerability, there is inconsistency, because we are at that intersection wherein something beautiful as an outcome is going to come very soon. That is why that horizon of 3 to 5 years we're talking about. Obviously, AI will keep evolving, keep improving, but trust the change, trust the process. I think that is what I would advise to whosoever asked that question. Vijay.
No, I'll concur with that. And I'll also say that trust in yourself, right? Like you have the power to change your future. And I think sometimes we don't speak enough of that. You have to trust yourself to be part of the change, trust yourself to be the change, and you can do it on a daily basis. You don't have to wait for anything external to drive the change you're seeking. So in my own words, that's what I would say is trust yourself and trust in making the change, and that will create the change.
I think that was one of the best answers we as audience could have heard here. One last question, I think, before we wrap up this session for today. Many companies currently rely on AI technology due to its cost effectiveness. However, if AI providers significantly increase their pricing in the future, what do you think could be the projected implications for companies that are completely dependent on them?
I think and I'll give it a very short answer because it's a nuanced response here. But there is this notion now called a token economy, and the token economy is where every LLM vendor, every large language model vendor, when they are looking at it, they are looking at but eventually all these things will become commoditized. But to navigate or to kind of circumvent the cost equation, what we are also doing is thinking about what we are calling small language models, which is think of a large language model as a university where you go to get a degree. Think of the small language model as a specialization you want to do or a career you want to get into after the fact. So you can be an engineer, you can get an engineering degree, and you may decide, I want to be a consultant and not a mechanical engineer. So these are choices you make. So an SLM is very similar to that. It learns from what the large language model has done, and then it caters to specific tasks. So our approach to AI, and I think you must have seen the recent acquisition of AR AI and other as a company, and that's part of this notion is how do we get self-sufficient and more reliant on our capabilities by leveraging what the market has to offer to what we can do ourselves to find the right cost value equation. That is going to be a constant process in our AI journey. And I know our AI officer, Ajay Sehgal, will have a lot more to say as these things unfold. But that is how at least I think about these things, that there's always going to be a token economy, which is what these AI companies kind of think of as their cost equation. We as consumers have to think about, what is the balance? And this is the same argument I make. Do you need a MacBook or can you use a Dell laptop? Depends on what you're trying to do. Not everybody gets a MacBook. Some will get Dell because that's what the work dictates. So the same philosophy will apply to AI is my simple answer.
The way I would put it is, obviously, the few companies who've kind of ventured into early stages into AI will have the early mover advantages for them. That is when they were in cash, a lot of it. But the way I see it is, AI is only going to become democratic from here. It is not going to get monopolized. People will come with different manifestations and different versions and different scales of AI, which will be fit to use and not necessarily like Vijay said that you need to have the topmost AI to solve the simplest of the problems. So I think economies of scale is all what we understand. As the demand grows, as the manifestation gets deeper, as the more and more humans start using AI, the cost is only going to go downwards from here because economies of scale will set in from here. Obviously, here and there, some people would like to take advantage of situations, but those will be incidental and not the norm. And the norm would be economies of scale would set in and the costs would eventually keep going down. I don't know if Vijay agrees to it, but that's the way how I look at it.
I mean, like all things, cost eventually becomes somewhat optimized over time because everybody tries to figure out what's the best way to approach it. So I agree with you, JJ.
Thank you so much. I think one last question before we close it, an interesting one that has come up here. Unlike traditional software, where platforms remain stable for years, how do organizations balance innovation velocity with sustainable ROI and operational costs in an AI-driven healthcare system?
So two fundamental shifts, and I'll keep it within 90 seconds in the interest of time. Two fundamental shifts are happening in the world of software, right? One is you are moving from a software as a service to service as a software. That shift has already happened. So what AI allows you to do is to create what I call services that can be orchestrated from using agents on top. So this notion of a software, like even if you look at software like, I'll use an example like Microsoft Office or Microsoft 365, whatever. Microsoft Copilot will become the orchestration that will feed data into an Excel, into a Word, into a PowerPoint. That's already happening. You are seeing that shift happen. So the services as a software is where the industry is moving to. And that's how we will have to think about our offerings as well. We are not creating products that are vertical. We are creating services that can be orchestrated depending on what the customer needs are. And that is the shift that you will see. And it will happen pretty rapidly here in the next 1 to 3 years. And that's where most organizations are moving. Even tools we use today, like ServiceNow or Tableau, all of these will start to shift in that direction very, very quickly. And that's the shift you're seeing. It's a simple answer, but there's a lot more depth in terms of how you do that shift at scale.
Right. And I will talk from a larger standpoint of health system as a whole. Obviously, we are a party to the health system. So healthcare ecosystem, technology is here to stay for sure. Any technology, even from as basic as a software, the question was, any technology which will reduce the cost of operations and will impact clinical outcomes positively will be the adopted technology and will be there to stay. If these two manifestations of technology, which is lowering down the costs and improving clinical outcomes, are not demonstrated by the technology, it will fade away like the many technologies which come and go. So I think key decisions when anyone adopts technology or changes technology, I think these are the two things which they'll keep in mind when they adopt new technologies or new softwares.
Perfect. Thank you so much. I think it was such an insightful session, and a lot of takeaways that I'm going back with is, of course, the skill set JJ just mentioned about being adaptable, agile, and continuous learning. Of course, Vijay, you mentioned about hybrid expertise and also the symbiosis of how we should. That perspective was really an interesting one. And I know a lot more. We will surely be coming back to this audience with a recording of this session. Thank you so much, Vijay. Thank you so much, Jashanjeet, for your time here today. Thank you, everyone. We will come back to you with our next edition of InSync. Until then, signing off. Thank you.
Thank you.
Thank you.